Good morning, everyone, and welcome to our webinar on policy discussions and developments, impacts on parents, children, and communities. As you know, I'm Meryl Levine, Senior Associate with the Children's Trust Fund Alliance, and we are so pleased to have all of you joining us today for our Birth Parent National Network quarterly webinar. This is our third webinar that we are offering, and we will have one more before the end of the year, and then we will be doing a virtual convening in the month of December. So we'll keep you posted in terms of all of the exciting developments. We just wanted to kind of highlight for you, please, as you can see on the screen right now, we would welcome if you would share your name, state, and role in the chat box. And I am also going to introduce my two co-facilitators that are here with me today and have been an active part of our work with the Birth Parent National Network. So with me today is Johnny Norris, a co-facilitator and a member of the BPNN from San Diego, California, and Isabel Regalado, who is a BPNN member from Arizona, from Phoenix, Arizona. So we are so excited that they are joining with us today to help facilitate the webinar. It's a really exciting webinar, so pleased that all of you are here to hear these updates. And I'm going to have Johnny introduce himself, and then Isabel, and then we will move on into our great program. Johnny?
All right, well, thanks, Meryl. Good morning, good afternoon to y'all on the East Coast and beyond. I am Johnny Norris, as Meryl was saying. I am a member of the BPNN. One of the things I really love about the BPNN and how it brings birth parents, and not just birth parents together, but agencies, workers, together to hear the voices of birth parents to move policies forward. It is just beyond anything that I could have thought about before joining, but it is just an amazing opportunity, and I absolutely love it, and I bet you all will too. Thanks, Meryl.
Thanks, Johnny. And Isabel, if you could introduce yourself and share a little bit about why it's been a great experience in the BPNN.
Hello, everybody. Good day, good morning. I am from Phoenix, Arizona, this beautiful sunshiny state with a lot of heat. Welcome to the webinar today. And I love being a member of the BPNN because it's a lot of information that is shared, community information, legislative information to help our families stay healthy, be active, give voice out there to the system, and just be really informative and keeping our families together and healthy. Thank you so much for being here, and we look forward to sharing all kinds of information today.
So thanks so much, Isabel and Johnny, and both of you have such a passion for this work, and it's so exciting to watch that. Now I'm going to turn it back over to you, Johnny, to review the agenda with everybody.
All right. Well, hello, everyone. We have a great agenda lined up for you all today. We will start by hearing an informative public policy update from Lauren from Casey Family Programs. After she will take some questions and answers. We will then transition to our panel of BPNN members who are using their parent voice in creative and impactful ways. We will then end our time taking final questions and completing the evaluation for today. We encourage you to use the chat and put questions in throughout our time together.
And Johnny, if you could continue on in terms of the objectives, that would be great.
You got it, Meryl. So here are a few objectives we will be discussing today. First, to provide education about the Family First Prevention Services Act and how states and tribes are implementing the law. To provide education about the Child Abuse Prevention and Treatment Act and community-based child abuse prevention. We will learn from peers about how they have provided education to inform the implementation of Family First Prevention Services Act and the Child Abuse Prevention Treatment Act and community-based child abuse prevention. That's a mouthful. And finally, we will provide a space to share and hear perspectives and priorities of our BPNN members.
Thanks, Johnny. And we're going to move into a poll right now.
Yes, ma'am. So moving on, before we begin, we would like to ask our attendees a couple questions in the form of polls. First, on a scale of 1 to 5, how much knowledge do you have about the Family First Prevention Services Act? And thank you, Trish, for pulling that up. Let's see how this is doing.
Yeah, we've got almost 3/4 of folks have already participated. I'll show the results here. If we wait maybe another 30 seconds to give folks a chance to answer. And then if you'd like, I could share the results.
That'd be great, Trish.
All right, let's go ahead and do that now. And
all right, so we got a variety. Some have no knowledge. Some have advanced knowledge. This is really good because this is one of the things we'll be talking about today. So if you didn't know about Family First, you'll hear a lot about it today. And if you're an expert, ask the questions towards the end. Well, thank you, Trish. So we're going to move on to our next question. On a scale of 1 to 5, again, how much knowledge do you have about the Child Abuse Prevention and Treatment Act and community-based child abuse prevention?
nearly 80% have already answered. Wait another 15 seconds, give folks a chance to answer, and then we'll show the results.
Thank you, Trish.
Looks like it's stopped moving. I think everyone's answered. That was going to, I'll show the results now with you.
All right, some more. There we go. See, this is good. This is how we see, who knows what and what we can grasp on when these subjects when we're doing these conferences. So thank you all for responding to these polls. This is really significant to us. And we'll be talking about both of these points. So moving forward, I want to introduce, I was going to say one of our good friends here. Yes, Ms. Lauren Basutti, to talk to us about the Family First Prevention Services Act. Lauren.
Thank you, Johnny. It's so good to be with you all. I am loving seeing all these names on here. It's so wonderful to be in community with you all and to talk about these important laws and policy and to get your perspectives and expertise to inform each other, to learn together. We're just thrilled that you've taken the time out of your busy days to join us and be a part of this. As those of you who have been coming to these sessions and engaging with the BPNN know, we have been talking about Family First for years now. And so we wanted to just give a little status update, really. So for those of you that have limited knowledge, we'll make sure to put some background knowledge or some background documents in the chat to help with that. But I just wanted, for those of us that have been engaged in some of the conversations and more intensely in some of the work, wanted to give a little update here. We have seen, several states now have approved prevention plans. So you'll see them up there, as well as a tribe have an approved plan. And then we have several states that have submitted their plans to the Department of Health and Human Services, and that they are in conversation with the Children's Bureau at HHS to really make sure that they're getting the feedback and getting on that path to an approved plan. So we are thrilled to see so many states, particularly in the past month or two. We've seen an influx of states really putting their plans in, as well as 3 tribes have their plans that have been submitted. So we're thrilled to see this, hoping to see several more in the weeks and months ahead. So if you don't see your state or your tribe up there, we are still very hopeful that we're going to be seeing a lot more in the coming weeks. We'll continue to provide some updates to you all. And I've included, I know the BPNN is always so great about sharing resources. So you'll see at the bottom here, there is a link. So when these slides do come out, this link is continuously updated as states and tribes submit and then get approved plans. So I encourage you to check back there. That is the most sort of up-to-date resource where this information really comes from. The other thing I just wanted to provide a quick status update on is that we are seeing a lot more programs be approved by the clearinghouse. And for those of you that may not be as familiar, there is a Title IV Family First Prevention Clearinghouse where programs that are eligible for the prevention services and the funding to support those are being reviewed, and then they're getting a different sort of levels of evidence are different levels of evidence are up there getting reviewed. So there's the promising, supported, and well supported. And so we're seeing many more programs, which is great. We hope to see many, many more, particularly programs that you all have really highlighted that have shown a lot of improved outcomes for either you as parents and or the parents you may be engaging with and the families you may be engaging with today. So really excited to see that. The most important thing now, though, is I want to turn it over to my friend Shauna King, who I've known for many, many years and has been engaged for many years. And I want, we're really hopeful and excited, for you all to hear from her about how she's been engaged in her community on Family First. Shauna?
Dosha, means Idakabe Hoba Mia, means Shauna King. And I just wanted to introduce myself in my language first, because when I started to do this work and I started to reconnect with my family, they always told me that my ancestors were behind me. So out of respect, I introduced myself in their language. So basically, I just said, hello, my name is Holy Owl Woman, and my English given name is Shauna King. So I guess, what I want to talk about is how I got involved in Family First. And I was doing all of the work that I wanted to do in my own community. And I just kept finding barriers and barriers and barriers. So I started looking on what I could do nationally. And one of the people that I reached out to was Meryl. And I kept hounding her. I'm like, hey, Meryl, I'm like wanting to be involved in more things. How can I know what I can do? What can I do? And so she told me about the Birth Parent National Network, and I became involved there. And that's when I first heard about Family First. And so we kept getting updates, and I'm just a person with lived experience. I don't have a degree in policy work. So sorry, that's my son in the background. I was kind of a little lost. I was a little lost, but I kept coming and I kept learning about it. And then I was able to join the BPAC, the Birth Parent Advisory Committee for KC Family Programs. And there we went into depth about it, and we talked about it a lot. And it started to make sense. It started to make sense on what I needed to help the families that I'm working with, and what I needed, what could have helped me. So I was asked to go to Washington, D.C., and go to the Capitol and testify on how this would have impacted me and how it could have impacted the families that I'm working with. And it was an amazing experience. It was awesome. You could definitely tell the people who wanted to hear and people who were very interested, and the people who were just looking at their clocks trying to make sure the time passed by so they could get to their next person. And then it didn't pass, and we kept getting updates, and we kept hearing about it. And the more and more I heard about it, the more and more I learned, and the more and more it made sense, because I didn't know what Title IV was. I didn't know a lot of things. And being able to be a part of BPNN and BPAC really helped me grow and with that knowledge, and helped me understand a lot more so that I could talk about it. And then it actually passed. And that was awesome. And I was asked to go back and to thank the people in DC for having passed it. And that was another amazing experience. And every single time that this happened, we had many meetings where we talked about what it meant to me or how it impacted me, and how I mean, I was very well prepared by everybody who had asked me to come, by the Children's Trust Alliance, by Casey. So I felt very prepared. And then when I came back to my own jurisdiction, which is Minnesota, I started helping Minnesota implement it. So I work with DHS. I feel like I'm one of the main birth parents that we have here that does a lot of work within the state. And I was able to have that advanced knowledge. I knew about this before my boss even knew about it. I remember coming back to Minnesota and saying, have you heard about Family First? Did you know that this is going to happen and it's going to change this and it's going to change this? She's like, I've never heard of that. And so I knew about it beforehand. So I've really been prepared to help my state be able to implement this. One of the things when we first started talking about it, it was such a huge change, and it was going to make a difference, and how that was going to happen and what voice birth parents had, I was able to bring to the table. And I was able to talk about what I talked about in DC. I was able to say, you know what? We need prevention services. We need services to start before child protection happens. We need culturally appropriate programs for families. I think one of the things that's most important to me when I get involved in testifying for anything, or not testifying, but being able to speak as a part of a birth mother or somebody that comes from lived experience, is that I bring my culture to the table. And I don't ever think I'll never not do that. As you know, I don't know if many of you know, but there's 574 federally recognized tribes. And 20 of those tribes have a direct agreement with the government, so they don't have to have agreements with the state. So if you have an agreement with the state like Minnesota, you kind of have to meet with the state and make sure that your tribal programs are involved. And that's one thing I've done. We have broken down in subcommittees here in Minnesota where we have candidacy to see who's eligible for having these services, prevention services, and tribal services. So I was able to join those subcommittees and bring a lot of knowledge to the table that even people who are, have masters were not, privy to. And I was very proud of that. I'm very proud to be a part of it in my state. One of the things that I feel that's really important to consider is that when we don't have the agreement with the feds, we have to go through the state and make sure that we have these evidence-based programs. One of the tribes that did have a direct agreement was able to get a program that was culturally relevant to them approved. And that program was cradle board making. So you make cradle boards for your babies, and they got it approved as an evidence-based thing because one of the questions was, how long has this been working for you? How long has it been a part of a program for you guys? And we were able to say, or that tribe was able to say, since the beginning of our people, we've been making this forever, and they were able to get that approved. Since Minnesota doesn't have that agreement, we have to agree with the state and go through DHS. It's really nice for me to bring a cultural perspective, especially from a birth parent, to the table, especially to being able to say, well, you know what, if I was at the table and I had a culturally appropriate programming for me, maybe my kids wouldn't have been removed. Or maybe if I had a culturally appropriate program, or the families that I'm working with had more culturally specific programs, we could actually use our medicines and our traditions and our ceremonies to help us heal. So it's very important for me to be at that table and to give a lived experience voice. I think birth parents have a unique perspective that not a lot of people who are making these decisions have. And it makes a difference when you come to the table and you know what you're talking about, and you've been able to help be a part of being a part of this act and being a part of all along while it was in the process of being passed, and learning about it and having that knowledge and being able to bring it back to my jurisdiction was something wonderful and amazing. And I'm super proud of, I'm sorry, my son's in the background. He thinks I'm talking to him. So I guess it just makes a difference for me to be at the table, and I lost my train of thought, but, and it's important for me to bring what I went through, my culture, and what the families that I'm working with
Wow,
are going through. So
that is
thank you.
really awesome. Thank you so much, Shauna. Thank you so much for sharing. It's great to hear from parents in our network and how they're engaging with policy work. Okay, we would now like to talk about another part of the continuum with Jim and Lauren. I will turn it over to you.
Great, thank you. I'm gonna kick us off here. If you could turn to the next slide, that would be great. So Jim and I are going to provide a little bit of background on the current federal law of CAPTA, the Child Abuse Prevention and Treatment Act. We're really setting up and providing some information so that we can have a discussion. We've saved a lot of time in this agenda to really engage and discuss so that we're all sharing our perspectives, our ideas, and listening to each other. But Jim and I, before we get into the discussion part, we wanted to provide some background for you all on CAPTA. And so I'll kick us off. It is a piece of current federal law. It really has two big areas. There's a lot in it, but the two big pieces to be thinking about are that it provides the framework at a federal level and resources to states as well as tribes in how they respond to child abuse and neglect reports as well as confirmed cases. So it's really on the front end of the system, a critical part of the continuum in terms of what the policy currently says, but also where the funding is. The second big area and very important area that we want to talk about is that it provides critical resources that many of you have talked about and know firsthand, critical resources to the community to strengthen families and really to promote well-being and prevention activities. CAPTA is, as Isabel beautifully said, part of the continuum. So we've talked about different pieces of policy in this group for many, many years, and Family First is a huge important part of this as well. We wanted to talk with you all about CAPTA today and about the community-based prevention, the CB-CAP dollars, which and policy, which Jim will provide more details about, because it is such an important part of this continuum. And as we build capacity as a network, and as we build capacity as individuals, really understanding the different components as themselves, and then also how they fit together and how they can better fit together, more importantly, is a conversation we really want to have. And so just another piece of background on CAPTA. So again, this is a piece of current federal law. It is what is called up for reauthorization right now. And so it expired, the funding expired a few years ago, but it has continued. Congress has continued to provide that funding, and Jim will provide some more details about that. But Congress has really been looking at how can we improve the framework and the policy around this. We know so much more about how to engage with families, how the front end of our systems are working well and not working well, and we need to really apply that to a revised piece of federal law. And so again, that is part of why we are wanting to discuss this with you today. The timing is really quite relevant and appropriate. Next slide, please. So I'll kick us off here, and we'll turn it over to Jim. Again, there are four main funding streams and four main areas here. The two that we're going to focus on the most are number 1 and number 4, but we'll talk about all of them. So the first one is the state grants. There are also grants that go to tribes as well. They are formula grants that are really provided to improve child protective services. So this is, and there are policies around this. So this is really the very front end of a child protection system. So the areas that this includes for funding, as well as for some policy areas, is really around mandatory reporting, intake, screening of cases, investigations, risk assessments, case management, and training. So these are all areas that I know you all have a lot to say about how it can be improved, what you may be seeing that's innovative in your state. But these grants are really looking at the very front end of the system to really provide funding for that, but also for states to get this money, they have to do sort of three big things. They have to submit a plan to the federal government, to the Department of Health and Human Services, and that plan has to outline their laws and policies at the state level of how they are actually putting these into their own state law and how they're following these pieces that I mentioned around mandatory reporting, screening, etc. The other area is that they need a citizen review panel to really evaluate the effectiveness of child welfare policy and practice. So those exist in all states, and there needs to be sort of an assurance that those are operating. And the third area is that states need to submit data to the federal government to get these funds for the grants. And that's the NCANS data. And they have to do that to the extent practicable. And so that means that there are some exceptions. So we do, if states can qualify that they are not able to submit certain data points for whatever reason, there are, that is allowable in current law. We know, and I know this group has talked about for many years, the power of data and really solid data to be able to inform decision-making, inform policy, to really be reflective of what our systems look like. And so that's another area, that states are required to do as well as they can. And another area that, is a big part of CAPTA. The number two, there are some discretionary activities in the area of child abuse. So these funds really are for just different areas of research, technical assistance, etc. And then the third, the Children's Justice Act grants are another area. These funds really support a range of different things, and including sort of the investigation and assessments. And Jim, I'm going to turn it over to you now to talk about the fourth area.
Thanks, Lauren. Hi, everybody. I'm Jim McKay. I'm the Policy Director for the Children's Trust Fund Alliance. My pronouns are he, him. It's so great to be here with you and talk about these issues. So for the community-based child abuse prevention program, or often shorthand, so we talk about CAPTA. That's the broad legislation, Child Abuse Prevention Treatment Act, or CAPTA. And then CBCAP is community-based child abuse prevention. And we're going to kind of use those interchangeably as we go, but that's what that all stands for. And as Lauren mentioned, so CAPTA has a long history, goes back to 1974, and then over time it has been adjusted, reauthorized, and we're now in the midst of a pending reauthorization, which we'll talk about in just a moment. But in the 90s, they added a Title II, just two, not four, Title II of CAPTA, which is the community-based child abuse prevention grants, CBCAP, and they actually kind of pulled in a lot of different kind of funding streams at that time. Some things around challenge grants that help Children's Trust Funds get expanded, some family support programs and family resource center funding and different things like that, kind of under this umbrella called CBCAP. And that's really where the community-based work happens, the prevention side happens. How do we create conditions that help build the protective factors and help families thrive and so forth. It's operationalized. Each state or jurisdiction, territory has what's called a CBCAP lead agency. over 60% of those are state children's trust funds, but not always. Some are also the child welfare agency, some are private nonprofit entities, some are public-private entities. Kansas is the governor's cabinet on children and families. So there's different considerations for that. Wisconsin's the prevention board and so forth. So you have a CBCAP lead agency. They submit a plan, a needs assessment each year, and then funding comes out to support those community-based efforts. There's also a technical assistance provider for those CBCAP lead agencies, and see Valerie Collins is on from Friends, and they do great work in technical assistance for those CBCAP lead agencies to know what works, how do we measure our success. So looking at the CAPTA fundings, Child Abuse Prevention Treatment Act funding, as Lauren mentioned, there's these different pots of funding. So the first one is kind of for Title I, or that child protective services side of things. In the current fiscal year 2021, so this is a federal budget deal that occurred in December of 2020. There's a total of just slightly over 200 million that's to these different buckets. 90 million is to the kind of CPS side, 30 million for kind of child protective services, and then 60 million for plans of safe care. The plans of safe care is folks are probably familiar, but it's what happens when there's substance exposed babies or concern about NAS or and those type of situations. How we can provide, the community child protective services can provide support for that family. So that there's a mandate that was admitted into the Child Abuse Prevention Treatment Act legislation around plans of safe care. A lot of ongoing dialogue about what could be improved in that program. We'll talk about that briefly, but there's 60 million for that, helping families affected by the opioid crisis and who are battling substance use disorders. So 60 million for plans of safe care, 30 million for kind of the child protective services system. There's the discretionary activities, 35 million, and then 60.6 million for the CBCAP grants. That is an increase. Across each of these, there's a modest increase, but particularly on the CBCAP dollars, over the last 2 years, we've increased from $39 million to 60.6. So that's about a 55% increase, which we're pleased to see. However, when you look at that's spread across all the states, plus tribes, plus territories, it's really not very much. And I think Lucretia might have some information she's going to share on that. Last but not least, certainly the Children's Justice Task Force, that intersection, our Children's Justice Act grants, the court improvement programs and so forth, and how the court system aligns with child welfare. And that's currently at 17 million. We are pleased, we'll go to the next slide, with the American Rescue Plan, and in no small part due to the voices of parents like yourselves who have spoken up and said, during the pandemic, we have had, it has revealed these great disparities and challenges that all families are facing, but particularly those who are particularly vulnerable and have been left behind by our inequities in our society and the different disparities. So we're pleased that Congress has responded to that with the American Rescue Plan Act, which was enacted earlier this spring. It provided $100 million for the state and tribal grants, again, the Child Protective Services programs and infrastructure, that Title I of CAPTA, and a really historic investment, $250 million for community-based child abuse prevention, those CBCAP dollars, to provide community-driven supports. States have submitted general plans for use of those dollars, but most of them are still rolling out those ideas. They do have between 3 to 5 years to spend it. Some states are doing that more upfront. Others are kind of spacing it out so they have sustainability. And there's a lot of efforts to make sure those funding levels get sustained moving forward in the advocacy space. But currently that's, a marketing increase in funding for those. Anything I missed, Lauren, on the funding piece? Great.
You got it.
So yeah, I wanted to kind of then, as we move forward, so this is kind of the background. We'll open it up for questions and so forth. But as we said, Lauren said, it's really expired, technically expired, although all the provisions are in effect until it's replaced. And Congress has continued to reauthorize. And we are not alone in that. There are a whole bunch of federal programs that are kind of past their expiration date, if you will, but they continue to be worked on and refined, and reauthorization is pending. So Child Abuse Prevention Treatment Act is part of that. Congress is really over the probably the last 2.5 years, or maybe 3 years at this point, has really been looking specifically at how do we make CAPTA stronger, and how do we bring it up to the needs of the 21st century. And so one of the first steps in that process was the House of Representatives, and they convened the House Help Committee, House Education, Labor, and Pensions, had a hearing with several presenters, but BPNN member Lucretia Rose, proud to say is one of my colleagues in West Virginia, superstar, spoke to her experience and so forth. So I'm going to let Lucretia share just what that was like, similar to what Shauna said about her experience with Family First. So take it away, Lucretia.
Thanks, Jim. I'm actually going to stop sharing the PowerPoint for a minute. I think it's a little weird to have my picture and my picture side by side. So I'm going to stop sharing that for just a moment while I talk. I hope that's okay with you guys. Thank you for letting me be here today and talk to you about what my experience was like testifying on behalf of CAPTA reauthorization. I specifically spoke to Title II funding and community-based prevention services and what that means for families like mine. And I'm passionate about sharing it because I hope that my story here today, or my sharing today, would empower you all to also feel the need to go storm the Capitol steps and share your voices if you ever have the opportunity, or you ever find something that you're really passionate about. I had done a lot of advocacy work within West Virginia. A real short story about me is, as I became a parent, I started to do what was done to me. And as all of you know, sometimes that isn't the best thing for your children, right? And so I was blessed to reach out for help and got help through community-based services before I ever entered the system. And so that was really key in my story. And I knew that there were other families out there just like mine. And I really felt empowered that I needed to do that. I needed to take responsibility in helping others find those same services that I did, and let people know that it's okay to ask for help. And that sometimes the way we were taught to parent is not always the best way for our children now, and that's okay. So although Families First had, come along and was great and is a great step in the right direction, that would have not helped my family at the time for my specific situation. And so I really just felt empowered to speak to the reauthorization of the funding. And like I said, I had done things here in West Virginia at the community level and at the state level, but when I was approached with this opportunity, I was like, are you sure? Like, you want me to do that? Like, okay, I'll give it a shot. I'll give it my best, at a girl shot at it. And was really nervous, and it took a whole lot of work, right? So I wrote my story down, and then I wrote it again, and I wrote it again, and I really thought about what I wanted to share that was going to have an impact to paint a picture of what it really looks like for families on the ground, that the policies that they are making and how it really affects our families, what it looks like in everyday life. I think sometimes their hearts are in the right place when they're making decisions, but they don't realize what it really looks like in communities with families that are disconnected from the Capitol, right? From those, from DC. And what was key in making that happen was all of the partnerships and collaborations that took place along the way. So not only did I have, of course, Jim on my side from the community, state, and national level, but I had a staffer by the name of Paula, and she was really key in helping me shape my story. And when I say shape my story, no one ever at any point tried to tell me what to say. I want to make that real clear. It was my story. It was my points that I wanted to make. And it was my lived experience that really mattered. But she was key in saying, listen, you have this many minutes. I read your story, and these are the things that stuck out to me that I think would be most helpful. And just really helping me find that happy medium of, okay, I don't have time to share my entire story. Here's the really important parts as far as passing this CAPTA reauthorization that's really going to hit home. And then, so that was a whole big process. And then come to the day of actually being in DC, and was really nervous. I just want to share that testifying there was not what I thought it would be. So it's not like you're up on a stand in a court of law and you're on trial and they cross-examine you and all of these things. It was a very warm, welcoming environment from the time I walked in the door until the time that I got to speak. And it wasn't just me, it was a team of people. And so each person who shared a real key part of what CAPTA reauthorization looks like, from the Children's Trust Fund level to community-based prevention services and programming. There was a medical professional who shared her point of view, and then I was the batter to hit the last home run and wrap it all up, and talking about what all of that really means for families like mine in my community. And also, after that, it opened up the door for other opportunities for me to also go to DC and share for part 2 of CAPTA briefing. So after they had talked about, okay, we're going to reauthorize it, but what does it look like? We wanted a stronger CAPTA. We wanted more money. We wanted more funding, because at the time when I testified, there was about $39 million. And now it is $60.6 million. So it is almost doubled, not quite doubled, but almost doubled. And the reason why I feel like my voice meant so much is because I saw the change. I had a partnership, I had collaboration, and it really felt good to actually make a difference and to see a change. And I'm starting to see those things not only at the national level and the state level, but also in my community. I will get you some popcorn in just one moment. Sorry, everybody. This is what families look like on the ground at home, trying to advocate for change in communities and states and at the national level. And she is my third child, and I'm a much better mother to her now because of community-based prevention services and things like home visitation and the passing of of Title II funding. So I don't know exactly anything else that I would share other than it does take a village. It wasn't just me standing up there sharing my story. It was a collaboration and partnership of a lot of different things. And no matter what you're most passionate about that affects your family, I just encourage you to feel empowered. They are people just like us. They put their pants on the same way that we do every day. The environment was very welcoming. And it was nothing like what I thought it was going to be. It was not as scary as what I thought it was going to be. And it really opened the door up for more opportunities for real change. And so I'll turn it back to Jim and Lauren to see if they have anything else that they want to add.
Thanks so much, Lucretia. Hi, Meadow. Good to see you there. She can't hear me because of the earphones, but it's great to see her always. Yeah. So I'm going to hand it back to Lauren to do some of the logistics and so forth, but amazing how much you did that. And then also really appreciate you lifting up the fact that others can do this too, and that there is a sense of support, because that's what we all collectively as partners want to do in all these cases, all these situations.
Yes, thank you, Lucretia and Shauna, amazing. And thank you both so much. You both have just incredible experiences, perspectives, expertise that just is wonderful to hear about. And we are just so excited to have you here. It's absolutely wonderful. So you are a tough act to follow because I'm going to be a little more technical here with some information, but then we're going to move right along to some discussion. So we wanted, just again in the spirit of sharing information and to make sure that everyone is aware of where things are. We have mentioned that this federal law is being considered in Congress right now. It has been, as Lucretia outlined, for a few years now. So there are two bills that we just wanted you to be aware of. And so the first one, the S1927, is in the Senate. And so that bill was introduced earlier this spring. And there was a markup on that piece of legislation, and the legislation passed out of the committee. So legislation starts in committees and then passes out of committees before they advance further. And so that piece of legislation really reflects a lot of the key areas that Congress has heard from parents, community leaders, and others around areas that could be improved. And it really includes information about taking a public health approach, a trauma-informed approach. It looks at how to prevent maltreatment, fatalities, and near fatalities of children. It looks at how are we screening and doing investigations to make sure that they are really using the right information and asking the right questions, and really looking at how to advance equity, particularly race equity as well. That is the Senate piece of legislation that is currently active in the Senate. And then on the House side, in the US House of Representatives, we have what is called the Stronger Child Abuse Prevention Treatment Act. So that's the HR 485 piece of legislation. So this piece of legislation was introduced and passed out of the US House of Representatives last Congress. So about a little over a year ago. And then each new Congress, so a new Congress started in January. So with that, because the bill didn't advance in the Senate, they had to reintroduce the legislation. So it was reintroduced earlier this year, and then again passed the US House of Representatives earlier this year in March. And that piece of legislation also really reflects a lot of trauma-informed care. The protective factors are really called out. It takes also a public health approach, and really includes a lot of different advancements in equity and other areas that are priorities for this group and many others as well. I do want to point out that both pieces of legislation are bipartisan. They're both led by the chair and the ranking member. So that's the lead Democrat and lead Republican for the committees. They're both led by both and have other co-sponsors. So it's really wonderful to continue to see major pieces of legislation being led in a bipartisan way. We love to see that and to really see that these are priorities for all members. There are some differences in these two pieces of legislation. There are a lot of similarities as well. And so over the coming months, we will be seeing how they might reconcile, how they might move forward. There are some different ways that could happen. Jim, is there anything you might want to add? I know we're dropping some resources just so you can do your own background reading and education on the specifics in these pieces of legislation. It would take a long time to go through all the pieces, so we're not going to do that in this moment. But Jim, any big major areas you want to highlight before we move along?
I think you covered the bulk of it. A couple of things that just to kind of put another point on. Again, we're just so pleased to see. I think lawmakers across the aisle listening on equity and recognizing need to address equity is a encouraging development. the provisions include increased authorization for appropriations, which has been long considered a challenge. We have certain expectations for implementation of these bills, and yet limited resources, particularly at the state and local level. And in particular, the Senate version includes increased appropriation for the set aside for tribes. So speaking to Shauna's earlier comment about the challenges of our Native peoples, and so that has been addressed in the Senate bill as well. And so we're following closely as the House and Senate work through their remaining differences. There's a lot of alignment, I think, in the spirit of what each bill is proposing and its emphasis on prevention and helping families stay together, as well as addressing things that have emerged. The Commission on Child Abuse and Neglect Fatalities made some recommendations. So lawmakers are exploring that. The plans of safe care under the Senate bill would change to its own title. Like we said, Title II is CBCAP. It would be its own title, and it would be called Plans of Family Care, much more of a health focus and less of a surveillance focus. And I think that's a concept that is also gaining traction when we look across different legislative proposals this year. The role of child protective services and the role of surveillance of families, which I know has been mentioned in different conversations with parents of how can we support families in lieu of expanding surveillance on families. And so the spirit of those provisions is definitely something that's being considered, but it's also not passed yet. So there's still opportunities for parents to inform and lift up and express your experience. So we're eager to hear what those ideas are further, because the expertise is certainly in people who have been through life experiences and the collective sharing of those. So thank you.
So Jim and Lauren, I just wanted to add in there, I know that you mentioned there's a lot of resources, and I just want to let everybody know that we will be posting them on the website and along with the recording and everything else. So I just wanted everybody to be aware. I know that they're getting put into the chat box as well, but we will also post them up on the website on our Children's Trust Fund Alliance website at the BPNN.
Thank you, Merle. Lucretia, are there any questions in the chat box?
There are. I have one from Sarah Shepard, and she says, is there a place where we can find research on lived experience and peer support and outcomes? So I'll turn that to you, and then there's one more after that. And I think that was directed towards Jim and Lauren.
Okay.
Okay. I can kick us off, but I welcome, others to add, because I know there's, our other presenters, and we have others on the line that can really speak to this. So there is a range of different emerging research and other areas in terms of parent programs. Casey Family Programs has worked closely with the Alliance for the Children's Trust Fund Alliance, and many of you on this call have informed a lot of that. And so we can put some links in the chat for that. There are a number of other areas too, in terms of the lived experience. And just to tie it also to the earlier part of the conversation, there are some programs that are in the Clearinghouse for Family First that have been informed by lived experience, that involve lived experience. And so just to link all of that together, there's a number of areas, and I welcome others to provide some input as well.
So Jenny's got her hand up too, but Jenny, you want to share? Do you have a question?
No, I was going to share. Casey's research team is partnering with Annie E. Casey and the William T. Grant Foundation to look at where there are gaps in research and where we need more. And they are going to have a consensus convening in October. Meryl, you're going to get invited along with Jim and Kara. as well as other networks that work with young people who have been in care and kinship and relative caregivers. So that's going to lead to some requests for proposals and funding of more research next year.
Great news. Thank you, Jenny, for sharing that.
There are, just in that research space too, there are some provisions both in the House and Senate CAPTA reauthorization bill, because CAPTA does fund some degree of research about child abuse, prevention, treatment, and so forth. And so there are some provisions in each proposal that would clarify, provide some additional areas of research and so forth. So that's something else that we'll be following, because federal investment in research, in addition to the great investments from our philanthropic partners, is really key, and also funding some demonstration projects to build the evidence for interventions. And I know many of us have been talking about peer supports and how we can help in that space. So things like that are certainly in the discussion for need for additional research.
The next question, it's a question and a comment. So the question is from Christina Salmons and ask, are there any opportunities to work for the BPNN as an attorney? And if so, she would love to know more about that, and left the email into the chat.
And you know what? I responded to her privately, letting her know,
Okay.
yes, there's lots of opportunities and we will be in touch.
All right, great. See the power of what these things can do. Next question is from Terry Green. It says, on a local level, my social work team is working with parents that have removed children and don't see the effect of this hopeful legislation. What should we be advocating for on behalf of our parents?
I would defer to Shauna and Lucretia on this one. I think they are the voice to answer this if you're willing to.
What was the question? I'm sorry.
Shauna, it's a situation then a question. So it says at the local level, the social work team is working with parents that have their children removed, and they don't see the effect of this hopeful legislation. So what should they be advocating for on behalf of parents?
Well, in the communities that I'm working in, I feel it's a little different. I think we're just getting to know what it is. So it's not there. We're not really right there, right? Especially with family first. But one thing that I always advocate for is what a parent, well, first of all, a parent's story is very important. But what brings you into child protection, usually there's underlying traumas. So what that person's going through, what's going to make a difference for them, and what's going to help them heal? Is that culturally appropriate programming? Is that counseling? Is that like long-term treatment? Is it treatment facilities that they can have their children in? What would make a difference for that family? And then making sure that they understand, like when I talk to families who are like, I want to do what you do, I'm very interested in what you do, I want to make a difference too. Being able to build that bridge and connect them to why something is important. And I bring a lot of the families, the moms and dads that I'm working with, to local meetings with me. I bring them to quality parenting initiative meetings. I just bring them in so that they can see like some of the change that has happened. I think one of the huge things for me was doing a lot of this work and with birth parent, foster parent partnership, and then being a part of QPI and having them pull up our documents and being able to pull them out and say, hey, look, we didn't know you did this, Shauna, or showing it to the families so that they can build that bridge between what the policy changes are that we're asking for and what is actually happening in real time with what's going on in their case plans.
And I would add that something that was really helpful to me when I first started out as a family in the community, and was that the very first time that funding for the community based services was, in danger of being cut, the director at the Family Resource Center was telling us, guys, I'm sorry, our funding might come to an end. We might have to end our programming. And I was like, oh no, what can I do? And she said, well, we have to talk to policymakers, and I'm happy to do that for you, but it is much stronger if it comes from you than me, because it's kind of like I'm singing for my supper and you're telling how it really impacts you as a family. And so if you are able, I would encourage that the families that you're advocating for become part of the advocation and advocate for themselves. And then it will start a peer-to-peer kind of role. And you'll have more than one voice about how, hey, this is how it's affecting us. And these are the changes we want to see, and let them be part of what they decide they want to advocate for. And so the next question in the chat box was, is the Washington Parent-to-Parent program close to being in the clearinghouse?
I'll take that. I don't know. I know that if I'm remembering correctly, they have submitted. The clearinghouse puts out the programs they're going to review next. And then just this morning, they came out with another email of the programs they have recently reviewed with their the category of evidence. So those come out, they don't come out on a regular basis. I would encourage you all to sign up for the notices. If you're interested in that, I can put that in the chat. You can sign up. It's just a free sort of email alert. But I have not heard anything. If others have heard something differently, let me know. But I don't have any more updated information. We are hopeful that it will soon reach a level of evidence for Family First. I know that team's been working very, very hard.
Thank you. There are a couple of different questions specifically around resources or support in California for family reunification. So I just wanted to put that out there in case anybody wants to share resources for that.
Patricia, can you repeat that again?
Sure. What types of resources or support are in California for family reunification?
Oh, okay. I'm not sure whether there's somebody I know there's a lot of people here who may be from California, and some might be able to respond to that.
I think Johnny would be able to respond to that.
I was just about to say something. Thank you, Shanna. Down here in Southern California, in San Diego, I work with paternal opportunities programs and services as a father advocate. We do have resources. We do reach out when it comes to family reunification. We mostly deal with dads who are dealing with reunification through child welfare services, and we assist with moving that forward. Right now, we are still locally based here in San Diego County. We're hoping to move as the pandemic comes to a close. We're hoping to move forward and move throughout California. We have someone up in Sacramento that's going to be building bridges for us up there as well. So that's what we hear in San Diego. I don't know where the question came from, where they're at in California, but we are a resource down here, and we do help out in those situations. I will leave my email in the comment box if that person wants to reach out to me, see if, what I can do.
Thanks, Johnny. I do want to share a couple comments that have came in. One from Sarah Shepard. She said, we advocate for recovery capital, protective factors, as well as recovery-oriented systems of care principles. And then Paula Samuels said, in response to the local level question, advocate for families, safe families, but families. We understand that there is trauma involved when child welfare is involved, so limit the amount of involvement. Fight for new and different ways to help families. Everything isn't solved with child welfare involvement. Training, support, resources, advocate for these things. And then there was another question in the chat that said, can you give a little more information from Sandra Killett on provisions in legislation around expert voice, lived experience, and strategies to prevent investigation and removal based on poverty. I think that Jim answered her in the chat box, but I wanted to bring it up here just to make sure that that was answered. I didn't want to let it go.
Yeah, just Sandra, so that others can see it. And there's so much in the details. That's a whole webinar in of itself. But Senator Lujan from New Mexico introduced legislation that was amended into CAPTA on the Senate Help Committee around alternative pathways of support, and it kind of builds off of some of the research from Chapin Hall that talked about the number of reports to CPS that are unsubstantiated. And so what is the pathway? So instead of investigating all these families when it is not an abuse or neglect situation, we know that child poverty and other factors are consideration. So lawmakers seem to be really interested in that and how they can decrease the number of unwarranted reports, but also make these connections to family strengthening services that build the protective factors. So there's several provisions, both in the Title I and Title II around that, and it would, as proposed by the Senate, it would call on states to articulate in their plan how they are expanding these alternative pathways. It's a little different than a differential response, which many states have. This would be a separate type of situation, perhaps with warm lines or other types of light touch, lots of different potential opportunities, but it is building off of research that Dana Weiner and Chapin Hall did last fall. And it's always exciting to see research turned into policy, particularly in a quick turnaround, which is where we are right now. And then the lived experience, needs to inform every step of that, especially at a community level. When you're talking about what community resources, what a families need, I think of the work that Arizona and Isabel, that you all are doing there around Lean on Me Arizona and so forth, of what families need for support. So you're right there on the front lines as usual.
So Jim, thank you. This is Sandra. I just wanted to say thank you for that. And I think it was just important to highlight that piece being in the legislation, particularly because we didn't have success in Family First, right? So this is all working together. And so Isabel, hats off to you and your community doing that work. But I will just reiterate that expert voice, lived experience, being a part of the entire gamut is enormously important, right? If we talk about culturally sensitive, we have to be at that table all the time. And so there is a lot of research going on. Thank you, Jenny, for that. But I can't reiterate that enough. And just when we talk about community prevention services, I mean, we have to look at, we've had community prevention services. I think, we need to be looking at with expert voice lived experience around community-based response. And I think that's where we'll really see a difference. So thanks a lot.
Thank you, everyone. Keep those questions coming in the chat box, and we will do our best to answer them. If we have some more time, we may do another question and answer. But for now, I'm going to turn it back over to Isabel and Johnny to lead us to our next part of the discussion.
Thank you, everyone. That was really informative. We'd now like to love to take a chance to open it up for a little discussion, and have you share in the chat on the Title II CB-CAP discussion. We're going to read off 2 questions here, and if you would share your thoughts on this, that would be really great. And let's just talk about it. When you think about community-based support for families, what do you think are the key elements? And what do you think could encourage more effective community and parent engagement in prevention activities? Now, for myself, when I was seeking family support or help for my family, the key element for me was to be able to have somebody hear me and believe in me. And it took a lot of hunting and I needed somebody really who would work with my girls. I knew what I needed to do, but I needed services for them. And it was really hard for me to get that therapy service for them. But stuff like that is what I would really think is key. And then working as the family, working whole, working on the family as a whole, and teaching us the tools that we needed in communicating with one another. That was something, like Lucretia said before, what I was doing was not right for raising my own children. And it was having to learn a whole new way of doing things. So that was my key element when I was looking for help for my family. Correct. Family therapy, as you stated, Diana, family therapy is definitely. Does anybody else want to chime in?
I do. This is Paula from Texas. Haha. Anyway, so I think one thing we have to remember is that community is different for everybody. The way that I define community could be very different than the way that another family defines community. And I don't think we should take any one definition and put it on everybody. I think we should really talk to them. I gave an example actually I think Tuesday or what have you. And I said, we say community-based and we want to keep families together, and that's great and wonderful. And I do. However, if you say, oh, okay, your community is your neighborhood, but I know that, 3 houses down, there's a child molester, 3 houses down on the right is a child molester, 2 houses down, there's an addict. Well, I may not want my children to get services necessarily, I'm saying services from that particular community. And so let me define what my community is. And that requires us to actually have an engagement and a conversation and some type of relationship. So I think those are key elements to hear. Like, for instance, you said what you would have liked. At some point, someone should have asked you that question and given you the things that you liked and needed. But most of the time, as parents, as families, we don't get that opportunity.
Very well said. Thank you. Very well said.
Wow, Paula, thank you for that. Isabella, if I could, I think one of the things about community, right, and which is the reason why I raised community-based response. Community-based response would allow community to respond to at least some of the things that Paula raised and a lot of things that happen in the community, right? And it's not necessarily your direct, it can be your direct community, right? But I think more importantly, it is people that are at the grassroots level that are coming up with ideas, situations, and response to a family and community situation, as opposed to, organizations, which it has been coming up with programs and such, and things that does not apply to families, or families don't feel that they're culturally sensitive to them. So that's what I mean by community-based response. And then when we speak about some areas of the family resource centers, I would just like to say there are areas that they're not run by the child welfare system or the foster care system, but then there are communities where they are run by the foster care system. But it could have looked different had they involved lived experience, voice in the planning, implementation of those family resource centers. Now, I can only speak to New York. I don't know about everyone, but I do know that when I heard about family resource centers at a conference, there was a center, I think it was in Colorado, I'm not sure, but they talked about how they had community involvement. And so that was of interest to me, but I knew that that didn't happen in New York City, right? So that's where I'm coming from with community-based response and expert lived voice in implementation and planning and development of anything that we want to do for children and families.
So right, Sandra, it's so important to have parent voice in there. so that way we can meet the needs of the community and work with others to bring it to the community to get the help that the families need. So thank you so much.
This is Robin Robbins. I just wanted to follow up with what Sandra is saying. It's hard to follow you, Sandra, but the first thing that came to mind when I look at that question is, what do you need? What are the key elements? And the first thought I had was funding, because I happen to be in a situation with my parent mentor partner in our local county where we have the parent voice, we have the support, we have the community grassroots people here ready to go that we know could really make a difference in our community, but we don't have any idea, or we're learning still, or need the support of how to build that from the grassroots, because the systems in place in our county that support families and communities are run by the systems in place, child welfare and the state-run agencies. So we already have those folks. It's more than just involving parent voice. We could create this from the ground up. In fact, we've had an experience, a smaller experience, where that was really positive, but we got to that barrier of, now what do we do next? Who's going to support us to find the building space, do the work? Because I think there's more of us available in our communities to do this work than we realize. The parent voice could be creating it, but we run up against that all the time. Well, how could we start our own business? And I know there are other places in the country, other states that have figured this out, but I feel like that's the barrier in our place. But I really appreciate what you said, Sandra, because I think it needs to be parent voice in the co-design, or even the only design in the creation from the grassroots direction. So thank you.
Thank you, everyone. That is really good to hear. I really,
Isabel?
yes.
Isabel, we have Timothy has his hand up. He may want to.
Oh, I apologize. Yes, go right ahead.
No worries. Thank you, Meryl. I totally forgot I had my hand up. I was looking in the chat and thinking about where there's some discussion in there about faith-based options, and I think, it strikes me that with here in Oregon, we have churches, synagogues, mosques. These are gathering places for folks to come together and create community, but these areas aren't for everybody. I think one of the things that I've come to realize over the years is that schools can be fantastic places for these kinds of gatherings. Like, there need to be forums or platforms where people can come together to be able to just community, right? So like, I wasn't aware of the resources in my community until I became involved with child welfare. And then after my case, sort of that went away until I got into this work and had to learn about these resources and these platforms for the parents that I work with. And what I've seen as far as being able to sort of sustain that sense of community and keep people from isolation and have people feeling confident is that you bring people together. Bring families in the community together, provide platforms for barbecues, movies outdoors, gatherings in the park where kids can play together. I mean, I know that we're sort of in a weird space with that right now, but anytime you get, 2 or more people together, 10 people perhaps together, that's 10 times the knowledge about the resources in the community, 10 times the support, 10 times the parenting experience to be able to strategize with other parents about struggles that we're going through. I really think that those platforms and those forums where we just allow folks to come together and be families in their community really helps to, I think it's a key element that I see really working well here. Thanks, y'all.
Thank you, Timothy. Meryl, am I missing anybody else? I don't have.
We have Shauna's hand up now.
Okay.
Thank you. Thank you, Timothy. We're on the same line of what I was thinking. One of the things that we do, I think it's important to understand that, Timothy's right. Not a lot of people understand what's going on unless you are involved in the child protection system. They don't know what support services are out there. So one of the things that we've done in the Native American community is we put out flyers. We also have mini meetings where We have the urban directors meeting, the Native American urban directors meeting, where all the directors of our community agencies meet. And then we have a mini one where the staff meets, and we invite people from our community there. We invite birth parents there. We also we hold like dinners where we talk about like what happens if you have an investigation open. We have just started doing this in the past 3 years, but we hold informative meetings for birth parents who are either going through something that needs some preventative services, or that are already in the system and don't understand exactly what is happening and what is going on. And then we also let them know what community agencies are out there that they can utilize in order to help them get through whatever situation they're in as far as child protection. But I think one of the things is just being transparent, being able to invite the people to the table, even if it's meetings where, you know, it's staff from all the agencies are meeting and we're going to talk about what we're doing. Inviting people from the community to those meetings has made a big difference, and it's made us kind of change the direction of where we're going. So I think that's really important. And I think one of the other things to encourage families to show up is food. To always provide a meal, then they usually show up. Thanks.
So, Isabel, we've got 2 more hands up here, and one is Jeremiah and one is Francis. So we might want, I know we're getting close to winding down, so we might want to go in terms of getting responses from both of them and then move on.
Okay, Jeremiah?
I'll be really brief. You know, I tell people, you know, if it takes a village to raise a child, what are you doing to be part of that village? So, and that includes placements. With early CAPTA things, the laws, parts of CAPTA was that the placement needed to be near the families near their communities. And if child welfare has a problem with the neighborhood, as being not a good enough neighborhood, then they have a problem with the neighborhood, not the family. And they need to go into those neighborhoods and develop the capacity for families to be strong, and not just say, well, we don't like the neighborhood. No, sorry, placement is where the families need to be at, and you need to work with them to build that capacity, be a part of a village that cares for children. Thank you.
Thank you, Jeremiah. Francis?
Yes, I will try to be brief as well. So one of the things that I've learned in getting a little bit more involved, especially with our youth and our teen parents, is kind of shying away from that professional language that I know a lot of us tend to kind of utilize when we're planning events, when we're doing outreach, when we're talking to a lot of the families in our communities. And this also applies for things that we are translating. I used to work with the refugee populations a couple of years ago, and I once had a mom who said, I don't understand this is in English. So I gave her a Spanish version, and she said to me, you translated it, but I still have no idea what resilience, like this word in Spanish doesn't mean anything to me. I don't know what that means. So I think really changing some of that language and remembering that a lot of these families don't speak the professional language that we do. They don't really know what we're referring to. And then also remembering that sometimes we have, again, like somebody mentioned previously, who is really supporting this family? If the first person that's going to see a flyer that's coming home is a grandparent filled with words that they don't understand, they're probably going to put it off to the side and not pass it on to the parents and say, hey, this is something that's important, or this is something that we should consider. So just always remembering to not just involve our, the parents that we might be working with, but having them look at things and say, like, yeah, this makes sense to me, or this is something that I would understand if I was a parent, because I know that we can get so caught up in that professional language.
Thank you, Francis. For the sake of time, I'm going to go ahead and move it over to Johnny.
All right. Wow. So many solutions, so many answers. Great job, everybody. We ask the questions, and what we look for is the solutions. We look for the answers, and so many of you are giving ideas on how to how to better the community. I had one, but I'm going to keep it for time. But we're going to push on with the Title I CAPTA discussion. Okay. I know we don't have very many minutes left, so when you think about the very front end of the child protection system, the mandated reporting, hotline, screening reports, investigations, etc., all of that stuff. What is working well to keep children safe and promote child and family well-being? And what could be working better?
So Johnny, just because of the fact that we probably only have about 5 minutes left, it would be great if people could put their responses into the chat. And if they don't have enough time to do that, we would love it if they want to email that information, but we would love to have that. And I don't know that we'll be able to open it up for discussion as much, but more if people would please put their responses in the chat, that would be great information for all of us to follow up on.
All right, y'all heard her. I'm gonna pass it back over to you, Meryl. Where's it, Lucretia?
It's fine. I wanted to kind of share, Lucretia, I don't know if you want to share anything new in terms of what's happening with the caring conversations.
I was on mute. I just wanted to say that the caring conversations do happen on Monday. As you can see here, at what times they are, it is 1 p.m. Eastern time. It has really grown to be a community, especially during times when we are, encouraged to stay apart. We've really found a family unit there in helping navigate the current times over the past year. And I really appreciate that group as my virtual family, and really it is the highlight of my week. And so it is only offered to members of the BPNN, the BPAC, and the BFPP. And so I encourage you, because it is for you, to join us and let it be the highlight of your week as well.
Thanks, Lucretia. And then I just wanted to make sure everyone is aware that we have another webinar. That will be our 4th webinar coming up on Thursday, October 28th. We are still working on the development of our topic for that. If there are particular topical areas that you feel like are pressing that we really need to address in the October webinar, please let us know. We are certainly open to that. And we always ask that you complete an evaluation at the end of each of our sessions. So please let us, please feel free to share any of your thoughts or ideas at that point. I want to say pardon me? Did somebody say something? I wanted to say really a heartfelt thank you to all of our presenters today. Lauren and Jim and Shauna and also Lucretia, awesome presentations, and so appreciate all of the wonderful thoughts and comments that you shared with everyone. I do hope that those that are members in the BPNN and those that are not but are thinking about joining, that these are opportunities where you can use your voice to help inform policies and practices, and that the BPNN staff, which include myself and Kara and other Alliance team members, will help to prepare you for these different times that you want to speak in front of different policymakers or leaders in your community, as well as help to brief afterwards. So all of it really takes practice. And I think that was a loud and clear message that was coming out through Lucretia and Shauna, in terms of, we were nervous in the beginning, but over time we got better and better. So we certainly want to encourage all of you. More voices helps in terms of us being able to make changes that will improve the situations and conditions for children and families all across the country. And so with that, I think I'm going to close us out, other than please remember to do the evaluation form. That will be really important. And also all of the information that was shared today will be posted up on our BPNN webpage on the Children's Trust Fund website. Okay. So, and the recording will be there as well. Any last minute remarks? Lauren, Jim, I do want to announce, Lauren didn't mention it. I'm wondering if she's still on here. Lauren's position is going to be changed. And I just thought, Lauren, maybe you could share with the group. It's really exciting, exciting news. And I didn't want to not mention it before we close out today.
You're very kind, Meryl. So I will still be working at Casey Family Programs, but I'm going to be beginning a new role there starting next week, working with the federal government and being placed in the Administration for Children and Families in the Assistant Secretary's office. So I'm going to be working on behavioral health, expanding and deepening our connections with lived experience experts, and working on early childhood and child welfare issues. And so I know I will be leaning on many of you, all of you, I hope, in this new role, and hope to continue to work with you all very closely. Thanks for the support.
Great, great news. Wow. Okay, anybody else before we close out? Thank you all. Great webinar today. Thank you, Lauren. Thank you, Jim, for all that great information that you shared in terms of the legislation. And we will be seeing you again, hopefully in October for our next webinar. Hope you all have a great rest of your day. Thanks for joining us.
Thank you, everybody. Bye-bye.